in Trinidad, we are seeing diabetes in our school children and high blood pressure. People at age 30 are having heart attacks. That is self-induced harm because of the way we live. So as we are modernizing the approach to our healthcare system, we must make sure that we live healthy lives so that we do not create a burden on the health system which we have to finance. We are importing food that is killing us. Let me say it again. Packaged processed food that you eat all the time is the harbinger of death. Grow your own food and eat your own food. I said that, the CMO, former CMO of Trinidad and Tobago. That is the key. Packaged foods with all the preservatives, all the hormones, all the antibiotics is the problem. You need to exercise. You drink alcohol in moderation, and we need to be careful with that because that excess alcohol, especially drinking among our young people, because our young people are drinking. No smoking of cigarettes, and you live healthy life. We need to be careful that we are importing lifestyles and then saying, let us use the medical systems of abroad to save us. We cannot do that because we will not be able to replace hearts, kidneys, joints, and all those things. They may have the money, but I will tell you, it's only the rich ones in those foreign countries that get these things. We can avoid all of these things. You don't have to have diabetes. You don't have to have high blood pressure. It's the journey, and we have children, so the journey we are on, because what we're doing here with the health insurance is a journey. You're starting to transform your health system, but the inputs into the health system also have to be transformed. That is how you control the costs. The inputs. We are the inputs.